which is why I have a little problem. So I don't believe in TPA, but I'm going to tell you to give it. Nihilism for the win. You need to have a departmental protocol. At our shop, we give it. We got the neurology, strike force. They come down. If they want to give it, I gave it recently. I had a patient within the last week that received this drug. I don't believe in it. It is a bad idea to sabotage this. Do not go in that room and tell the family, this is going to make your head explode and you should never receive it. You need to work with your colleagues. You got to work with them. You are crazy cakes if you go this alone. You should not be a cowboy out there just doing what you want to do. You need to work with your local folks, both your neurologists and also within the department, to figure out what you as a group is going to do. It's much like chest pain. Sure, you can say, oh, I have this interpretation of the heart score, yada, yada. You need to develop a chest pain pathway. Okay, that's really what needs to happen, because you will get sued if you don't give it. So what if you have a negative non-contrast head CT? If it doesn't get better with TPA, you're going to go endovascular. When do you use it? You need to use a checklist. I'm not even going to give you the contraindications. You need to Google this before you give it. I'm serious. Just look it up. There's a lot of finicky things about what kind of surgery and when and how bad it should be. Just look it up, okay? Because you're not going to remember it in the heat of the moment. Key thing, don't give aspirin to these folks for 24 hours. So let's say that major stroke is a STEMI, because they're treated much the same way. Catheter-based care is probably the best if you get there in time. Thrombolytics may help, a subset, much the same way that STEMI is helping. Decreased treatment benefit the farther you get from the start is likely the case, although that's less clear in stroke. And you should always give aspirin if you're not pushing lytics. In STEMIs, you should give aspirin anyway.